Très bien, donc nous allons maintenant
So we'll now deal with
de l'ordre du jour. Donc, qui est le plan
Agenda
d'action
item
pour la santé
5I,
sexuelle
Action
et
Plan for Sexual and Reproductive
avec la
Health
mise en œuvre du programme
towards
de
achieving
développement
the
durable à l'horizon
2030
2030
Agenda for
en
Sustainable
Europe.
Development in
Ces
Europe,
personnes de côté.
leaving no one behind.
Les documents
The relevant
correspondants
documents
portent les
can be
codes
found in
13, Conf
documents
Doc
13,
9,
ConfDoc
13 additionné 1.
9 and 13
Donc, ce plan
add
d'action
1.
a
This
vu le
action
jour à la
plan
suite de séances
emerged from
d'information
the
technique
technical
qui ont été
briefings
organisées lors
during
des
the
sessions
regional
du
committee
comité
meetings
régional
in
en 2014 et en
2014 and
2015. Il a
2015.
été élaboré en concordance avec le cadre
It was developed
stratégique
in
européen
line with the
Santé 2020,
European
le
Strategic
programme
Framework
développement
Health
durable
2020, the
2030,
2030
la
Agenda
stratégie mondiale
for
pour la
Sustainable
santé de la
Development, the
femme, de
Global
l'enfant
Strategy
et de
for Women's,
l'adolescent
Children's and
2016-2030,
Adolescents Health
la déclaration de Minsk
2016-2030,
sur
Minsk
la
Declaration
démarche
on the
parcours de
Lifecourse
vie et
approach,
d'autres documents
and
politiques,
other regional
régionaux et
and global
mondiaux.
policy documents.
Ce projet de plan d'action qui
The draft
nous est
action
présenté
plan
aujourd'hui propose une approche
tabled today
globale pour
proposes a
l'amélioration de la
comprehensive
santé
approach
sexuelle et
to
reproductive de
improving
tous
sexual and
et pour
reproductive
la lutte
health of
contre les
all
inégalités qui
and
subsistent.
decreasing still remaining
Il a donné lieu à des échanges
inequalities.
nourris, nombreux,
There have been very
parfois animés.
many and
Sur ce document
often
de travail,
active
j'ai voulu
consultations
m'associer à
on the
un
working
certain nombre
document. I
travaux
was
sur
involved
l'écriture
myself
et
in
bien sûr aussi
this
sur le projet de
drafting work
résolution.
and
On
also
se réjouit
on
donc
the
qu'on ait
resolution.
pu avoir un grand
I
nombre de
welcome the fact that there
délibérations
was
constructives.
a great deal
Il
of
nous reste
constructive
aujourd'hui
deliberation, and
à
it remains
présenter ce
today
plan
to submit to you
grâce
this plan,
à la présentation, à
thanks
l'intervention du
to
Dr Gauden Galea,
the presentation
le
of Dr.
directeur de la
Gauden
division
Galea,
des maladies non
Director of the
transmissibles,
Division
qui va présenter
of
ce dossier avec le
Non-Communicable
Dr
Diseases, who will
Gunta
jointly
Lasdan,
present this
chef
with
du
Dr.
programme santé
Gunta
sexuelle et
Lasdan,
génésique.
Program
Et
Manager
je
for
crois que
Sexual and
Yann Asko
Reproductive
est
Health,
également présent
and Jan
comme
Asko is
ressource.
also present as
Voilà,
a
Dr
resource
Galea, je
person.
vous donne la parole.
So Dr. Galea, you have the floor.
Mr. President, Madam Regional Director, Deputy Director General, ladies and gentlemen, it is my pleasure, with a hint of hesitation, that I start the presentation on the Sexual and Reproductive Health Action Plan. And in sexual and reproductive health, it's important not just what you do, but also how you do it. I will pause a moment to let that hidden pun sink in. I'm going to talk about how. Gunta will talk about what. And then when we discuss the question, Ian, who is Director of Reproductive Health and Research in Geneva, will also be part of the resource person for the discussions. One thought I had when I stood up would be to take a picture of this group, like now, because this is a very long history and a unique moment. Whatever happens next, it's a very important moment. We have, since 1994, with the International Conference on Population and Development in Cairo, been having a global discussion. Numerous other global meetings in UN, in WHO, World Health Assembly, have led to an elaboration of the concepts and the principles of sexual and reproductive health. But the only document in Europe that we have ever had is the European Sexual and Reproductive Health Strategy, adopted in 2001, not by the regional committee. There has never been a discussion at the regional committee on this subject. Indeed, our discussion now is the first time that this theme has come to the attention. It's not because it's an easy document, it's an easy subject. Clearly, there have been difficulties in the past, but this group, you together with us, have had the courage to face and are deliberating most intensely on the content of Sexual and Reproductive Health Action Plan. And with this picture of the consultation that we had last December, I would like to discuss at least outline the process that has led us to the document that we have here, because it's extremely important to basically make the claim, assert the claim, that this document has followed every single existing guideline on the process of consultation, and that the process itself is impeccable and cannot be impugned. It starts as far back as 2014 in the regional committee with a technical briefing where we had on women's health, where we had the first demand from a number of member states that as we were discussing women's health, we should also be looking at sexual and reproductive health. And over the next months, we also consulted countries that have their own sexual and reproductive health. We were joined in this by sister UN agencies such as UNFPA and others. And we were asked that the time was ripe to have a sexual and reproductive health in those days and rights action plan that was distinct from the women's health strategy that we were developing and which this regional committee will have the chance to address tomorrow. Fast forward to October of last year, an invitation was sent to all 53 member states to come to the consultation that is pictured here in the middle of December. This invitation was accepted by 38 member states who attended the consultation, and they received the first version of this document at the beginning of December. After that, a period of written submissions was, 8 countries afterwards produced written submissions. We produced a new version, discussed also with the Standing Committee in Paris last December. 8 weeks of consultation, of written consultation, then opened this year, leading to a new version that was discussed and approved by the Standing Committee in March. Between March and April, we took on the multitudinous comments. We have recorded, according to the normal process, 103 pages worth of written comments that we received. Each of these comments is recorded in terms of whether it was noted, if no action was needed, whether it was rejected, and why, which comments agreed or disagreed with each other. Finally, we have the lineage of basically every paragraph in this document is recorded and can be made available on request. And it is not normal process at this stage to make these comments widely available or translated in all the in all the official languages. The next version was discussed at the open meeting of the Standing Committee in May, adjacent to the World Health Assembly, and we produced then, taking the comments and some meetings with individual countries that were held bilaterally during that World Health Assembly, we revised the final version that you saw on the 1st of August, produced by us in the first week of June. We have since received written comments from a number of countries and have entered into a series of telephone conferences and exchanges by email, all of them documented in case they are needed, in order to try and clarify the difficulties that some countries were expressing. So I've gone into some detail on the process to suggest that there is probably no other document before this regional committee that has been so intensely discussed and so much consultation has been carried out. The situation, of course, is that there is still a lot of controversy. There is no need to hold that back, but also many signs of countries that are reaching agreement on processes and the way forward. Before we get to that, I'll hand over to Gunta, who will take us from the how into the what. Thank you.
Thank you, Gauden. Mr. President, Regional Director, Deputy Director General, colleagues, I am standing here and thinking about how and what. I was trembling that much in Minsk on Lifecourse, and actually now even thinking about how to go forward. Gauden?
Just press the green button.
The green button. You see? So, Lifecourse approach. A Lifecourse approach was that Minsk conference with all of them. The only difference was of this big, very important conference that at that moment the temperature in the hall was plus 15 degrees, and many of those who were there remember that. Now we have heated it up. Yes, sexual and reproductive health is an essential part of health and well-being through the Lifecourse, and Lifecourse approach is one of the guiding principles of the action plan. Concept of sexual and reproductive health, of course, is very difficult. Yes, sexual and reproductive health has been defined during International Conference on Population and Development in Cairo more than 20 years ago, and the discussion group just during the coffee break reminded me about those discussions that were in Cairo. During these years, major achievements in improving maternal and perinatal health, decreasing the number of unintended pregnancies and unsafe abortion have been made. However, ensure further improvement of health, a comprehensive, much broader approach is required and has been used in developing this action plan. Technical working definition of sexual health has been used throughout the consultation process. Health and human rights. There have been a number of member states who have been questioning that, but there is also a number of documents approved by these member states at United Nations, World Health Assembly, and this regional committee. So that confirm that health and well-being requires respecting of human rights of all and everyone. Now, sexual reproductive is very sensitive and very private, but the environment is full of sexual messages. All of us, including our children, our grandchildren, are exposed to such photos, having possibly damaging consequences on public health and well-being. People grow up in a context where sex is used for marketing and where holistic sexuality education is not a norm. So that's why we are trying with this action plan to do the best to ensure that all people can answer their question on sexual reproductive health, that they are satisfied, and different population groups are doing the same. Action plan presents a holistic approach to sexual reproductive health. And member states in this action plan have agreed that WHO European region is a region, or will be a region, in which all people, regardless of sex, age, gender, sexual orientation, gender identity, socioeconomic condition, ethnicity, cultural background, and legal status, are enabled and supported in achieving their full potential of sexual and reproductive health and well-being. A region where their human rights related to sexual and reproductive health are respected, protected, and fulfilled. And a region in which countries, individually and jointly, work towards reducing inequalities in sexual and reproductive health and rights. This is the road. We have set the road. However, it's still a long way to go, and we can achieve the goal only together. Thank you.
Merci pour ces présentations.
Thank you for these presentations
Introduction
and our
sujet.
introduction, or your introduction to this subject.
Pour l'avis du comité permanent du comité régional, je propose
For the
à
opinion
Amélie
of the
Schmitt,
Standing Committee of the Regional Committee, I'd propose
de
Amélie
faire,
Schmitt of
sa
France
présentation.
make her presentation.
Merci, Monsieur le Président.
Thank you, Chair.
J'ai le plaisir de vous
I am
présenter la
pleased
perspective
to
du
provide the
CPCR sur le
Regional
plan
Committee with a summary
pour la santé sexuelle et reproductive.
from the
Comme Gauden l'a
SCRC
souligné, dans le cadre
on
du processus
sexual and reproductive
d'élaboration
health,
de
as
ce
Gauden
plan,
has said, in the
de
process
nombreuses
of
consultations ont eu lieu,
developing this
tant
plan,
avec
various
l'ensemble des États
consultations
au
took
sein
place
du
both
CPCR.
with member
En
states and
2014
in
et
the
2015,
SCRC.
plusieurs étapes ont
In
abouti à une
2014-2015,
meilleure
various
des
stages led to a
facteurs
better
qui influent sur
understanding of the
l'amélioration de la
factors
santé et
influencing
du
the
bien-être aux
improvement
différents stades de la vie,
of health
et ce,
and well-being
y compris en
at
matière
different
de
stages
santé
of life,
sexuelle et
including
reproductive.
in sexual and
Notera,
reproductive
comme l'a
health.
mentionné
In
Gauden
particular,
auparavant, les
as
séances
Gauden has
d'information
said, we'd
technique
note the
lors des
technical
sessions du
briefings
comité régional
during
en
the sessions of the
2014 et
Regional Committee in
2015. La
2014-2015.
conférence ministérielle
The
européenne de l'OMS à
WHO
Minsk,
European
dont on a
Ministerial
déjà
Conference
parlé, qui
in
s'est tenue
Minsk,
l'an
which we've
dernier,
already
et qui s'est
mentioned, which was
attachée à
held
l'adoption
last
d'une
year and
perspective
which
portant sur toute la
dealt
durée
with
de la vie dans le contexte de santé 2020.
actions during different stages of
Les
life that
États
are
membres
essential in
ont ainsi
improving health.
confirmé l'importance des documents de politique
Member states
existants
confirmed the importance of
relatifs à
existing
l'amélioration de
policy
la santé
documents
des
with
enfants
respect
et
to the
des
improvement of
adolescents, ainsi que des personnes âgées.
child and adolescent health,
il a été
as well
noté
as
qu'il
the
manque à la
of
région
older people.
européenne
But it
un
also
plan
noted that the
d'action
European
pour
region
l'amélioration de
does
la
not
santé
have an action
sexuelle et
plan for
reproductive.
improving sexual and reproductive health.
La santé sexuelle et reproductive est bien entendu une affaire
Of
très
course,
personnelle.
sexual and reproductive
Chaque
health is a
personne
very
est en
personal
droit de
issue.
faire ses
Each
propres choix.
person can make
Cependant, les
his or
preuves
her own
scientifiques
choices according to
disponibles confirment que
available
les États sont en
scientific
mesure de
evidence.
favoriser un accès
States can
universel à la
assist
santé sexuelle et reproductive et de
in
lutter contre
having
les inégalités
universal
en
access to
santé.
sexual and reproductive health
Le
and
5e
reducing
objectif du
health
programme de
inequalities.
développement
The
durable à l'horizon
fifth,
2030,
the
adopté l'an dernier,
fifth
nous
goal of the
rappelle l'importance
2030
de cette
Agenda for
problématique
Sustainable
mondiale
Development
et
adopted
les
last year
efforts à
reminds us
fournir
of the
en ce
importance
sens.
of this global issue and the efforts
Le
to
plan
be
d'action pour la
deployed.
santé
The
sexuelle et
action plan for sexual and
reproductive se
reproductive health
distingue de nombreux
differs
autres
from many
documents
other
stratégiques.
strategy
Il
documents.
porte non seulement sur
It
la
deals
santé
not
sexuelle et
only with
reproductive,
sexual and
sur la santé
reproductive health,
maternelle et
maternal and
périnatale,
perinatal
mais aussi sur la, je cite,
health, but
réalisation
also on the
intégrale du potentiel de chacun
achievement of the
en
full
matière de
potential
santé et de
of
bien-être
each
sur le
individual
plan
for
sexuel et
sexual and
reproductif.
reproductive health.
Ce plan d'action
This action
encourage
plan
tous les pays
encourages
à
all
la fois à
countries
améliorer la
both
santé
to
sexuelle et
improve sexual and
reproductive et le
reproductive health and
bien-être
well-being,
dans ce domaine, mais aussi
and
à
also
réduire le
to
fardeau de
reduce
la
the
morbidité
burden
de
of
leur
ill health of their
population en ne
populations,
laissant personne de côté,
leaving no one
c'est-à-dire
behind.
en
In
accordant
other
une
words,
attention
by
particulière aux groupes
paying
vulnérables,
particular attention to
défavorisés
vulnerable,
et difficiles à
disadvantaged,
atteindre.
and hard-to-reach groups.
Ce plan d'action s'est initialement inspiré des
The initial
résultats de la
draft action
réunion
plan
du
was
groupe
based on the
consultatif
results of the
d'experts
April
qui a eu lieu à Trieste
2015
en avril 2015.
advisory expert meeting in
Cette réunion a
Trieste.
rassemblé les
This
pays
meeting
européens qui
brought
avaient
together
récemment
European countries
élaboré
which
ou
had
étaient en train
recently
d'élaborer
developed
leur
or
stratégie
were in the
nationale
process
en
of
matière de
developing
santé sexuelle
their
et
national
reproductive.
sexual and reproductive health
Le
strategies.
processus d'élaboration
The
du plan
development process
a
of the
également fait
plan
intervenir des centres
also involved
collaborateurs de l'OMS,
WHO collaborating
des experts
centers,
et des
experts,
partenaires travaillant en
partners
étroite
working in
collaboration
close
avec le programme
cooperation
relatif
with
à la santé sexuelle
sexual
et
and reproductive
reproductive.
health program.
Entre avril 2015 et mai
From
2016,
April
deux
2015 to
consultations
May
techniques,
2016, there
4
were
débats
2
techniques
technical
et une
consultations, 4
consultation
technical
politique
debates,
ont eu lieu
and 1
pour
political
l'ensemble de la région
consultation
européenne de
throughout the
l'OMS.
European region of
Ils ont permis à
WHO.
35 États membres
They
et
enabled
à 5
35 member
ONG
states and
de
5
formuler leurs
NGOs to
commentaires et
provide comments and
suggestions.
suggestions.
Vous le savez,
As you
l'élaboration
know,
de ce
the
plan a
development process of
suscité
this
un
plan
large débat.
led to a very
Le
major
CPCR se
debate.
félicite du
The Standing Committee
caractère
values the
ouvert et
open and
transparent de
transparent
son processus
process
d'élaboration
in
et de
developing and
finalisation.
finalizing the action plan.
Le CPCR est conscient
The
des
Standing
divergences
Committee of the
d'attitudes
Regional
entre les
Committee
personnes,
acknowledges the
les
difference in
pays et les
attitudes to
cultures
sexual and
face à la
reproductive
santé
health
sexuelle
among
et
people,
reproductive.
countries, and cultures,
Il se réjouit
and
que des
is
commentaires et
pleased that
suggestions
comments
des
and
États membres
suggestions of
soient
member
parvenus
states
au
have been
secrétariat.
carefully
Celui-ci
studied
les a
and discussed by
minutieusement
the
étudiés
Secretariat,
pour introduire un certain nombre de
and a
modifications,
number of changes
en
were
aspirant à ce que le plan puisse
incorporated.
être appliqué à
We hope that
l'ensemble des
the
pays
plan can
membres.
be applied to all member states.
En conclusion,
As I
le
finish,
CPCR accueille très favorablement
might I
ce
say
plan
that the
d'action
SCRC warmly
Il le
welcomes
considère
this
comme un
plan and
document de
considers that it is a
référence
very
extrêmement
important
important
reference document.
et encourage vivement
We
le
therefore
comité
strongly
régional
encourages
à
the Regional
l'adopter.
Committee to adopt it. Thank you very much.
Très bien, merci Amélie.
Thank you,
Nous allons
Amélie.
pouvoir,
We'll now open debate, and I would ask delegates who wish to speak to show their flags.
Donc nous avons eu très vite la Hollande, pardon, les
very
Pays-Bas.
quickly saw the Netherlands. I'll get that right this time.
Je suis obsédé par mon président, et la Géorgie.
And then Georgia. So the Netherlands and Georgia,
Donc les
please.
Pays-Bas.
Thank you, and I also speak, of course, on behalf of President Hollande. I know. The Netherlands welcomes the action plan for sexual and reproductive health. We are ready to adopt it. Sexual and reproductive health and rights are of the utmost importance for achieving the 2030 agenda, not only in Europe, globally as well. We would like to commend WHO Euro for the extensive consultation process of this technical document. All stakeholders have had ample opportunities to provide input. The result is a balanced, comprehensive document that covers all the important elements. And it's of great importance that we adopt this document at this meeting. Thank you.
Merci beaucoup, les Pays-Bas.
Thank you very
Je
much,
passe la parole à la
Netherlands.
Géorgie.
I now give the floor to Georgia.
Thank you, Chair, for the opportunity to speak. And Georgia would like to congratulate a Regional Office for Europe for development of such an important document and fully endorses the Action Plan for Sexual and Reproductive Health. We commend for Action Plan being so comprehensive and holistic and approaching it from the lifelong health perspective. So we consider reproductive health as a key priority and as a matter of the national safety and security. Substantial progress has been made by Georgia during the last 15 years in reducing the maternal mortality and the perinatal mortality. Abortion rates have been halved during this time frame. And also the contraceptive prevalence rates have increased. Number of very important policy initiatives, as well as the scale-up of the evidence-based interventions and the Universal Health Coverage Program contributed to this progress. However, the work is not done yet. There are still challenges. There are still high rates of the maternal and perinatal mortality and morbidity. And there is still abortion that is used for the family planning. While there is a further need to strengthen delivery of the high-impact evidence-based interventions, we have the new realities and important challenges, such as addressing the adolescent health, reproductive health and rights, and their needs for education on sexual and reproductive health that have not been sufficiently addressed until now. So continued improvement in sexual and reproductive health must remain priority, and we have to ensure that no one is left behind. The government of Georgia is committed to this goal and has intention to substantially improve the reproductive health through revision of the policies, improvement of current policies, and through comprehensive evaluation. To this end, European Action Plan for Sexual and Reproductive Health is very valuable to inform our ongoing efforts in this area. In March 2016, Georgia hosted regional consultation meeting, which was attended by 17 countries in Eastern Europe and Central Asia to review the final draft of the European Action Plan for Sexual and Reproductive Health. It was very intense discussion, and this consultation, I have to say, triggered commitment of many countries in our region to develop their own national action plans. Georgia is in the process of finalizing a new forward-looking national strategic document and a costed action plan, which is fully aligned with the action plan for sexual and reproductive health. And the new strategic document covers maternal and newborn health, family planning, sexual and reproductive health of young people, and based on the principles of the Lifecourse approach, continuum of care, action based on the best available evidence, building governance and capacity of intersectoral action, particularly of education and the social sector. The process is led by the Ministry of Health and includes the multi-stakeholder groups, including different government institutions, NGOs, professional associations, and we would like to support our key partner, UNFPA, as well as WHO Regional Office for Europe for being so supportive. We welcome and fully endorse the new action plan for sexual and reproductive health, and we see this as an essential document to ensure that we maintain progress in reproductive health and achieve better and more equal health and social outcomes for women. Thank you.
Très bien, merci beaucoup. Je passe la parole
Thank you,
à la
Georgia.
Turquie.
I now give the floor to Turkey, to be followed by Turkmenistan.
Thank you, Chair. Since this is a high-level health platform, I don't think anybody would be against the provision of sexual and reproductive health services at an attainable highest level. Also, there should be no discussions on term sexual and reproductive health. Nevertheless, although the heading of this document is sexual and reproductive health, I try so hard to understand the concept, but I must confess I couldn't. So claim your sympathy for my possible misinterpretation. First, there are already so many internationally agreed documents on this issue flying around. I'm experiencing difficulty to understand why we are adding another one echoing the same issue. It should be because of the others are not sufficient enough to reach our common goals. In this case, this one should contain something different. Nevertheless, I'm afraid I cannot catch that particular point. Second, although everything related to human life is in the concept of health, as we see in the definition declared 70 years ago in the Constitution, it's not logic to put everything on the shoulders of health ministries, especially like this issue, consisting too many social-cultural elements inside. Believe it or not, in the document at page 9, Objective 1.1 gives us an order to recognize the sexual rights by law. More or less, I'm working with WHO nearly for 10 years, and I'm not trust my memory, but that's the first time I've seen such a commanding language in a document. I think we exaggerated a little bit the role of health ministries. We reached a new level for governance. Indeed, governance is not enough anymore. Health ministries should take the roles of national assemblies. Third, there's a new wording used first time in a WHO document, sexual rights. I Googled if I missed the definition of sexual rights. There are definitions, but not in the WHO or UN documents. Abracadabra. Just after they approve this action plan, then we will have a new term that we don't know what it means. Fourth, in this regional committee, we have 3 documents different in names but similar in content. Women's Health and Well-being Strategy, HIV Action Plan, and Action Plan on Sexual and Reproductive Health. It shouldn't be so difficult to blend these. Lastly, WHO is a member of UN family, and there are sister organizations focusing on their domain. These organizations should work together in harmony, not in duplication. Since this issue is in the domain of UNFPA, I cannot understand the point the Secretariat is planning to get by preparing that action plan. Now, you may say rightly that why we didn't share our reservations before while this document opened for web consultations. I'm afraid we missed that chance. But unfortunately, in these circumstances, I'm afraid Turkey is not ready to adopt this action plan and resolution as it is. We suggest SCRC should reconsider that document again. I'm sure it will be possible to come a common ground. Thank you, Chair.
Merci la Turquie. Je passe la parole au Turkménistan.
Thank you, Turkey.
Qui sera suivi par le Danemark.
I give the floor to Turkmenistan, then Denmark.
От имени Министерства
Thank you, Chairman. On behalf of the Health Ministry of Turkmenistan, I would like to express our thanks to the Regional Office of WHO in supporting this plan of action on reproductive and sexual health. It's a very up-to-date, timely plan, and it's been worked out in the light of Health 2020. It's also based on human rights, and it's in step with the CEDAW Convention, the one on discrimination against women and its eradication. We participated actively in the consultations on this, and we've also worked in the standing committee on it as well. In Turkmenistan, we've been working hard to improve the health services we offer mothers and children. We encourage women to have children, but contraceptives are used in Turkmenistan not so much to prevent women from having children as to ensure their sexual and reproductive health. We have managed to bring down the deaths of mothers to under 7 per 100,000 births, and that in 3 years. We are trying now to guarantee full access to reproductive and sexual health services, including family planning services, the provision of information as to how to protect one's sexual and reproductive health, and that through national programs. We have adopted a strategy on improving the health of women, newborns, children and youth, and we have made changes and amendments to it in the light of the Sustainable Development Goals. We are getting support and assistance to achieve this goal and many others from many sources, and we're grateful for that. We believe that what we are doing will help us to better achieve the Sustainable Development Goals by the deadline and ensure indeed that no one is left behind. Thank you. Thank you, Turkmenistan. Denmark, to be followed by France, please.
Thank you, Mr. President, Madam Regional Director. We would like to thank the Regional Office for having taken this process forward. The right of everyone to decide freely over matters relating to his or her own body without any discrimination, without any threat, and without violence, these rights are essential to Denmark. No one should be left behind. Sexual and reproductive health and rights for all must be advanced and must be respected. We believe that the 2030 Agenda for Sustainable Development in Europe must be implemented with this in mind. We were pleased to receive the draft action plan last December from the Regional Office, but we also believe that the current draft has, to our disappointment, been weakened, and we would, in several places, have preferred to see stronger language. However, we also see the current action plan as a compromise, and we are inclined to be flexible with wording because we are convinced that adopting an action plan for sexual and reproductive health is highly relevant and important. Therefore, Mr. President, we are ready to adopt the action plan as it stands. Thank you.
Merci, Denmark.
Thank you, Denmark. France and then Portugal, please. Thank you, Chairman. France would like to congratulate the Secretariat on the plan of action it has proposed for sexual and reproductive health. We also welcome the extensive and inclusive consultation process which was handled by the Secretariat. Sexual and reproductive health and the rights thereto are a fundamental human right. What is at stake is to ensure that the entire population has access to complete sex education and has the right to take freely, well-informed decisions on their own private life. This should be based on government policy which takes a universal approach to promoting sexual and reproductive rights. Therefore, France welcomes the efforts made by WHO to draw up an ambitious reproductive and sexual health action plan for our region. We particularly appreciate the adoption of a positive global view, recognizing the role of sexuality in human development and well-being. The action plan is based on well-being and individual freedom, and that we think is a good thing. We do, however, regret the removal of the words sexual rights from the document because we think that it is important that we protect and promote the human rights of men and women, girls and boys. We therefore strongly regret that we did not find consensus on stronger language. Having said that, we are aware that this is a very sensitive issue and that the Secretariat did its very best to reconcile national viewpoints which sometimes are diametrically opposed. In the plan proposed to us today, we now have text which we believe to be acceptable to all countries in the region. We would therefore like to thank the Secretariat very much for its hard work to bring that about. Ensuring sexual health is sometimes done in a piecemeal fashion, and we need an intersectoral approach which is more coordinated among the various parties involved in education, health and social services in particular, but of course under the aegis of the Health Ministry. France has developed its own national sexual health policy for 2017 to 2030, and that will be based on the guiding principles of the WHO Europe Plan of Action. We will be looking at population groups, risks and diseases, and those are the three pillars of our approach. It will be part of a general policy to improve sexual and reproductive health inter alia by mobilizing all parties involved at local and national level. France has also just completed drawing up its new 2017-2020 strategy on population and sexual and reproductive rights, and that, I think, also reiterates its commitment to tackling these important issues. Thank you. Thank you, France. Portugal to be followed by Latvia.
Merci, Monsieur le Président.
Thank you.
Portugal fully supports the action plan for sexual and reproductive health towards achieving the 2030 Agenda for Sustainable Development in Europe, leaving no one behind, and we are ready to adopt it, leaving no one behind. In our view, it will be a step towards the inclusion of sexual and reproductive health and rights into national public health strategies and programs. In fact, that already happened after 2001, according to our experience, with the publication of the WHO European Regional Strategy on Sexual and Reproductive Health. Portugal then seized the opportunity offered by the strategy to formulate policy documents and national guidelines. It is time now for an update, a new reflection, new dialogues, since this comprehensive framework needs to be adapted at national level. Besides that, this very well-structured document puts forward key interventions on sexual and reproductive health care and rights, reflecting the Health 2020 principles and the 2030 Agenda. We wish this action plan constitutes a guide, a statement of the region, and an inspiration for other WHO regions. Thank you.
Merci,
Thank you, Portugal. Latvia and then Malta.
Latvia expresses highest appreciation for the work done on developing on the new action plan for sexual and reproductive health. It's both right on time and very important for Latvia. We fully support its emphasis on equity and availability of people-centered care, as well as on lifelong approach and evidence-based policies in reproductive health. Maternal, perinatal, and child mortality and morbidity are one of the most important indicators that characterize the general state of the public health system. According to these indicators, we can evaluate the availability and quality of public health and reproductive health services. Unfortunately, almost every year, cases of maternal mortality are registered in Latvia. For that reason, maternal and child health is among top objectives of the Ministry of Health of Latvia. Our priority is to start from the early years and to reduce prevalence of non-communicable disease caused by several risk factors, including unhealthy and unbalanced diet and sedentary lifestyle. As we all know, smoking, consumption of alcohol, drugs, and other addiction-inducing substances have an extremely negative impact upon pregnant women's health and on the fetus. Sexually transmitted infections play a crucial role in the occurrence of complications. Child health is significantly affected by mother's health, her lifestyle, and habits before and during pregnancy. With the support provided by Regional Office of Europe, the Ministry of Health Latvia, in cooperation with nutrition specialists, gynecologists, and other healthcare specialists, is planning to prepare nutrition recommendation for pregnant women and is going to be based on already developed national guidelines on nutrition during pregnancy for health professionals. Hence, we will provide society with easily understandable information about the significance of nutrition, lifestyle, and other important information. Currently, we are also introducing confidential inquiry into maternal death, near miscarriage case reviews, and other key action mentioned in the action plan. And therefore, we are fully support the action plan. Thank you.
Merci la Lettonie, Malte.
Thank you. Latvia, Malta, and then Germany.
Thank you, Mr. Chair. Malta would like to thank the Secretariat for the work done and the extensive consultation that has taken place in the development of the action plan presented in document R6613, and appreciates the difficulties encountered in compiling the document. We feel that the document presented to us, like previous drafts, still has a heavy bias on the prevention and management of sexually transmitted diseases and unwanted pregnancies and sexual and reproductive rights. As stated in our intervention during the consultation meeting held in this very room last December, while we strongly believe in the individual's right to sexual and reproductive health, we feel that less emphasis should have been placed on sexual and reproductive rights, and more emphasis being made on the wider aspects of sexual and reproductive health, in particular on sexual and reproductive health education and promotion within the norms and values of the family and society. Malta is pleased to note that the content and the title of the document have been portrayed in the context of Agenda 2030. It is therefore surprising to us that the phraseology used is not consistent with Agenda 2030. While this does not constitute a red line for us, we reiterate that we would have repeated what we have repeated throughout the consultation process, that in line with Agenda 2030 text, we would prefer the use of the reference to sexual and reproductive health and reproductive rights as opposed to sexual and reproductive health and rights. We are also pleased to note that all references to sexual and reproductive rights are qualified by a reference to footnote 1. We regret to note, however, that the text of the qualifier in footnote 1 has been changed from the standard text used in all other UN fora. In footnote 1, the words "and with international and regional human rights treaties" have been added at the end of the standard qualifier. This is totally unacceptable for us, and we would not be able to agree to the action plan if such text is not deleted from footnote 1. We therefore ask for the deletion of the words "and with international and regional human rights treaties" from footnote 1. We further note that similarly the words "and with international and human rights treaties" have been inserted in paragraph 19 under the section entitled Scope. This too is totally unacceptable for us to be able to accept the document. However, following informal constructive discussions with other member states, as a compromise, we propose that this paragraph is amended as follows, such that paragraph 19 would read: "The action plan provides for a comprehensive framework that addresses sexual and reproductive health. It needs to be adapted at the national level, in line with the international commitments that member states have already made, including the ICPD Programme of Action, the Beijing Platform for Action, the outcome documents of the review conferences, including regional review conferences, as well as to the SDGs in accordance with national legislation, capacities and authorities." Lastly, Mr. Chairman, Malta also feels that the explanatory note in paragraph 2 of Annex 2 is unnecessary, as it is not relevant to the better understanding or adoption of this action plan, and we therefore also have reservations on its inclusion, and we ask for its deletion. Thank you, Mr. Chairman.
Thank you, Malta. Germany, please. to be followed by Sweden.
Thank you very much, Chair. Germany thanks the Regional Office for Europe for the preparation of this draft Action Plan for Sexual and Reproductive Health. Germany supports the action plan and is in favor of it. Promotion of sexual and reproductive health is a basic condition for a healthy society in which human people, despite age or sexuality, can take their own decisions for family planning on the basis of their own sexuality. Basic condition for this is to ensure that national laws contain rights for sexual reproduction, must have access to services of advice in terms of individual target groups. Thirdly, a lower threshold for access to contraceptive means. We feel that this must be guaranteed, and that will have a major impact on the well-being of people and the health of the people. There should be obligatory sexual education in schools, and that has contributed to ensure that in the last 10 years there's been a halving of teenage pregnancy. State and non-state organizations dealing with HIV and other STDs has led to a lower STD rate in Europe. The basic conditions play a role in the action plan on sexual and reproductive health. The action plan is not a single document standing alone. It's based on the conditions that the international community has already dealt with in political frameworks and programs. Aside from regional and global strategies on health, we also have the 2030 Agenda for Sustainable Development and the Minsk Declaration. This means that the action plan is based on a solid basis. It deals with intersectorality and health, Lifecourse health. The draft action plan for sexual and reproductive health is a possibility for all member states of the European region to deal with the health and well-being of its people. Germany wishes to take this opportunity and urges all the member states to support the action plan and implement it. Thank you very much.
Thank you, Germany. Sweden to be followed by Estonia.
Thank you, Mr. Chair, distinguished delegates. Sexual and reproductive rights are a cornerstone in human rights and a prerequisite for women's empowerment. The right of all people to sexual and reproductive health and rights must always be protected and stood up for, especially the rights of women and girls, which are more often challenged, as well as the rights of LGBTI persons. Against this background, we warmly welcome the draft action plan on sexual and reproductive health and rights, which the Regional Office first presented to us in December. It constituted an important update, progress, and complement to the regional strategy from 2001. However, the draft action plan that is being presented to this committee has been diluted well below the ambition that Sweden has for sexual and reproductive health and rights. Some member states seem to be moving away from the commitments made just a bit more than a year ago in EU Council conclusions on gender and development. This is a cause of grave concern to us. Even so, Chair, in the interest of reaching consensus on this very important matter, Sweden is willing to accept the proposal made by Malta. Last word of para 90 should read priorities, I think. It is a development that will not benefit women, girls, and our societies as a whole. Women and girls have the right to decide and exercise control over their own body, sexuality, reproductive health, and childbearing, with access to adequate maternal health, which also provides safe and legal abortions. Young people in particular should have access to contraceptives. We must prevent and combat all forms of violence against women and girls, including violence in the home and family, and violence and oppression in the name of honor. Everybody, boys and girls, as well as women and men, should be protected from early and forced marriages. To make this a reality, we know that objective and evidence-based sexual education is key. Mr. Chair, we commend the Regional Office for their hard work in developing the action plan. By the support from the Regional Office through the action plan, Member States in the Euro region will be encouraged in the capacity building and move the work forward in the area of sexual and reproductive health. Hopefully, the adoption of the Sexual and Reproductive Health Action Plan, where views obviously differ between Member States, could be the start of a transparent process where experience can be shared in depth, and we will be able to move forward in a constructive manner. Sweden is fully committed to continue its efforts nationally and internationally to develop the sexual and reproductive health and rights. Finally, Chair, we request that our statement is included in the official report. Thank you.
Merci la Suède.
Thank you, Sweden. Estonia, to be followed by Tajikistan. Malta, did you wish to take the floor again?
Merci.
Okay, thank you. Estonia, then, please.
Thank you, Mr. President, Honored Director General, dear colleagues. Estonia welcomes the timeliness to discuss the action plan for sexual and reproductive health towards achieving the 2030 Agenda for Sustainable Development in Europe, leaving no one behind. Having said that, please allow me to thank the Secretariat and especially Gauden and Kunta and their teams for the enormous job completed. By adopting the 2030 Agenda for Sustainable Development and the related Sustainable Development Goals, all United Nations member states have confirmed their commitment to SDG targets, especially towards Target 3.7 and Target 5.6. Also, SDG 10, reducing inequalities within and among countries, is crucial for further improvement of sexual and reproductive health. In addition, and as referred by my distinguished Turkish colleague, there are several processes to improve sexual and reproductive health in the Euro region. May I name the European Health and Wellbeing Policy Framework, the Minsk Declaration, which we just discussed here in Copenhagen, or the Lifecourse approach in the context of Health 2030. But all of these need further acceleration. New evidence and recently approved global and regional strategies clearly indicate the need to develop a new European action plan for sexual and reproductive health and rights. All member states should be empowered to achieve the full potential for sexual and reproductive health and well-being of all people. Our region has been and shall remain a forward-leaning leader, advocating for up-to-date policies regarding SRHR. However, we are a little bit concerned that there has been some weakening in the languages, but we take regard that this has been done in order to achieve the needed compromises. Still, having heard some statements delivered by different member states, Estonia is disappointed that not everyone in the WHO Euro member states might be able to enjoy the positive results derived from this action plan. As for the action plan, we think it is very relevant and covers many important topics comprehensively. We are especially happy to see older people, intimate partner violence, and comprehensive sexuality education included, especially education outside of the school system. We also welcome the inclusion of sexually transmitted infections, the latter being closely linked to the global health sector strategy on STIs. Having said that, and to conclude, Estonia truly hopes that we are able to adopt this action plan aimed at reducing health inequalities, strengthening public health, and ensuring people-centered health systems that are universally accessible, equitable, sustainable, and offer high-quality care. Estonia remains strongly committed to support WHO endorse this end. Thank you.
Merci l'Estonie. Je passe donc la parole
Thank you, Estonia. Tajikistan, to be followed by Poland. Tajikistan, please. Regional Director, Chairman, ladies and gentlemen, protecting sexual and reproductive health remains one of the main areas that the health system in Tajikistan is concentrating on. Over the last 5 years, thanks to the efforts of our government and through cooperation with our international partners, we have improved our technical and professional services in our health system. We have expanded them to reach the more remote areas of the country, and we've succeeded in bringing down both maternal and child deaths quite considerably. However, the risks of mothers dying in Tajikistan is still too high. 1 out of 530 women die in childbirth. At the moment, Tajikistan has a high level of births where every one woman gives birth to 3.8 children. We need to increase the amount of contraceptive use in Tajikistan. As far as family planning and the safety of contraceptives is concerned, we are working on a plan to improve both. Our Ministry of Health and Social Protection has tried to increase access to sexual and reproductive health services for young people and youths so that they can enjoy their full sexual and reproductive rights. We have already prepared a document on the provision of sexual health consultations and services to young people and youths, concentrating particularly on groups at risk of health problems. This is a policy which has been confirmed by the Tajik government. We are planning on developing an integrated strategic plan on reproductive and sexual health and on the health of mothers, children and young people to cover the period until 2030, this based on health throughout the life cycle. This will be looking at the priority areas of activity which we think will help Tajikistan to guarantee the possibility for its whole population to enjoy their sexual and reproductive health and well-being to the full. We support this document and we would like to express our gratitude to Guntalazana for his leadership in preparing it. We're also grateful for the wide-ranging support given to our country in its attempts to improve the population's sexual and reproductive health. Thank you.
Merci, Tajikistan.
Thank you, Tajikistan. Poland, to be followed by Switzerland.
Thank you very much, Mr. President. Mr. President, Madam Regional Director, Honorable Ministers. Action Plan for Sexual and Reproductive Health towards achieving the 2030 Agenda for Sustainable Development in Europe, Leaving No One Behind, that has been presented by the Regional Office, is a result of a long and complex negotiation process. Poland was one of the member states that has actively participated in this process since December last year. During the series of consultations, we had an opportunity to present our detailed position on several elements that are particularly important for us. We are fully aware that issues related to sexual and reproductive health are a very sensitive matter for many delegations from our region, and we want to assure you that these issues remain also a high priority for the Polish government. The presented action plan contains many elements that are in line with actions undertaken in Poland to improve sexual and reproductive health. However, there are some elements that are problematic for us and some that are missing. Firstly, we believe that adoption of the 2030 Agenda for Sustainable Development changed the commonly accepted language concerning sexual and reproductive health and related rights. Target 6 of Goal 5 of SDGs clearly indicates that the international community should ensure universal access to sexual and reproductive health and reproductive rights, as agreed in accordance with the Programme of Action of the International Conference on Population and Development and the Beijing Platform for Action and the outcome documents of their review conferences. By adoption by the whole international community, this language is an agreed goal that we all should strive to achieve, and all international strategies and action plans, especially those elaborated within the UN system, should be fully aligned with it in terms of content and language used. We regret to notice that presented action plan uses the language that is not fully aligned with SDGs. Furthermore, we would like to underline that since the action plan touches upon very sensitive issues, also in regard to adolescents, we believe that a proper balance must be kept between what must be ensured by the state and what lies within the responsibility of parents or legal guardians. In our opinion, the action plan itself stresses some provisions of internationally agreed documents, like those regarding privacy, but ignores the others, like those regarding the role of parents. The right of parents and the role in upbringing and educating their children have been underlined, among others, in the Convention on the Rights of the Child, International Covenant on Civil and Political Rights, and Universal Declaration of Human Rights. Therefore, we would like these rights to be stronger recognized in the action plan. We are also aware that there are other member states that have similar reservations and concerns with regard to this document. Finally, we would like to underline that Poland does notice the so-called national clause contained in paragraph 19. As stated, country-specific situations, national legislation, capacities, priorities, and specific national circumstances are key determinants of the action plan. At the same time, the elements we described earlier that are not included in the text, from our point of view, are a prerequisite to be able to adopt this document. Concluding, we see the progress that has been made, but we are not satisfied with the final result of negotiations on the action plan. However, if the consensus on the action plan is to be reached among other member states, we will not block it. Thank you.
Merci, la Pologne.
Thank you very much, Poland. I give the floor to Switzerland, which will be followed by the ex-Yugoslavian Republic of Macedonia. Thank you, Chair. Switzerland would like to thank the Regional Office for the development of this plan of action, which is determinant for the health of women in the European region. They are the heart of this document, and therefore we're ready to adopt this plan of action. Chair, the strategy and the action plan when it comes to sexual and reproductive health have been used as a guideline for the development of national programs for HIV and other transmissible sexual diseases as far as Switzerland is concerned. It is also a framework of action for the cooperation between Switzerland and Eastern Europe and Central Asia. Switzerland is in favor of promoting sexual and reproductive health and that in a general form. And here we regret that the present version of the plan of action does not include the idea of rights. It was the case that rights was included in a previous version. Apart from this central point, the elements that there are some elements that are particularly relevant for Switzerland. Firstly, the importance of having the determinants that influence sexual and reproductive health. The need to have a multisectoral approach is also very important. Then priority given to prevention and prophylaxis, as well as eliminating discrimination and stigmatization. Also the need to target those populations that are particularly at risk, migrants, for instance, and the possibility to give a sexual education for children and young people, which will enable them to acquire the necessary knowledge in order to develop their sexual identity and to ensure their sexual health, and this not only within the formal school framework. And also the need to cooperate with state actors and non-state actors in the implementation of this plan of action. In conclusion, Chair, In a European context, where we can see that there's an increase of sexually transmitted communicable diseases, we need to attach particular importance to these questions, and so Switzerland feels that this plan of action has to be implemented immediately, and this in a spirit of cooperation, and therefore we can agree in that spirit of cooperation the amendments made by Malta and also by Sweden. Thank you, Chair. Thank you very much, Switzerland. And so now I'll give the floor to the former Yugoslav Republic of Macedonia, followed by Hungary.
Madam Regional Director, respected delegates and guests. I would like to start by stating that Republic of Macedonia fully supports the Action Plan for Sexual and Reproductive Health towards achieving the 2030 Agenda for Sustainable Development in Europe, leaving no one behind. As a minister, His Excellency Nikola Todorov stated in the 83rd edition of the journal Entre nous, WHO, we are committed to making a mid-term review of the national SRH strategy to align to the global and regional trends initiatives, including the Action Plan for Sexual and Reproductive Health. The mid-term review will culminate in development of an action plan for implementation of the National Sexual and Reproductive Health Strategy, considering the recommendations of the mid-term review. We have also conducted national assessment of all the 30 maternity facilities for provision of emergency obstetrics and neonatal care services, strengthened the health system through introduction of over 40 evidence-based policies and guidelines, and introduced the WHO methodology for confidential inquiry for maternal deaths. In addition, for the first time ever, the foundation of the three main pillars of comprehensive family planning services has been set, addressing both the demand and supply side. The country is also recognized in the region for speedily and successfully introducing the minimal initial service package for sexual and reproductive health into country politics and services, serving as an example of a true collaboration among all stakeholders in the country. Positioning of the health sector in the multi-sectorial approach of gender-based violence management has also been strengthened to propose of SOP for migrants and with focus on the existing transit centers. All these interventions have been guided by human rights principles and international standards. Lastly, the Sexual and Reproductive Health chapter is part of the Crisis Preparedness Plan for the health system in the Republic of Macedonia. Thank you for your attention.
Thank you very much. And I give the floor now to Hungary.
Thank you very much, Mr. President. Mr. President, Madam Regional Director, Honourable Ministers, colleagues, we highly appreciate the hard work invested into the Action Plan for Sexual and Reproductive Health, showing the firm commitment of the WHO to promote international public health. It is our best interest to reach a consensus document. Having said that, Hungary wishes to emphasize in this context the importance of the recently adopted Agenda 2030 for Sustainable Development Goals, the SDGs, which have established the framework which should be respected and used also by the European region. Our primary task should be to implement these goals. Although the action plan is in several ways in line with these SDGs, there is one issue which should be raised by Hungary when finalizing our work in respect of the action plan. This is the SRHR approach and language which is used in the action plan but concerns us most. Hungary considers as a great importance to reiterate its position on the usage of term SRHR in the WHO fora. The term of sexual and reproductive health and rights, SRHR, is lacking consensual definition. On its own, it has no internationally agreed meaning. It is rooted in national laws. Hungary deems that in this context, a very clear basis has been laid down with the SDGs, creating a framework that should be respected and used as our guiding principle for our work for the next 15 years. SDGs clearly define the scope of international processes, therefore sexual and reproductive issues shall be interpreted and promoted in the context of 2030 Agenda for Sustainable Development, the ICPD Programme of Action and the Beijing Declaration and Platform for Action in line with relevant national legislations. Hungary, as we have stated it from the outset in several consultation forums, wanted to see the new approach and consistent use of the UN-agreed language SIHR and SRH and RR in the whole text. During the negotiation processes, with the new title, Hungary had a strong feeling and sincere hope that this approach could be acceptable for the member states. Although we welcome the wording in the title, the text is still using consequently the SIHR language and reflecting the SIHR approach, and Hungary has the strong feeling that there is no 100% agreement in the region in respect of this debated language. We share the same concerns as Malta and Poland, and we support the compromise proposals presented by Malta, which helps to improve the text of the action plan. Having said that, we still have some serious concerns about the following point. Point 45 says that the regional office will prepare a list of indicators in consultation with member states following the adoption of the action plan. In our view, the European Action Plan should promote the implementation of the goals and targets based on the new SDGs. Furthermore, monitoring and reporting should be carried out in connection with the framework of the Sustainable Development Goals, using the monitoring system and indicators set up within that to avoid duplication. Hungary has formally suggested a text which put emphasis on consultation about the necessity and feasibility of a new list of indicators and not about a new list itself. Hungary's main priority is not to duplicate monitoring mechanism. Our proposal is to change the text of para 45 on page 19 to the followings. Existing global and regional agreements, strategies and action plans should be taken into account if selecting new regional and national targets and indicators is feasible and appropriate. See Annex 1. The regional office will consult member states about this issue after the adoption of the action plan by the 56th session of the Regional Committee for Europe in September 2016. In the spirit of the compromise, Hungary is ready to take into consideration of not opposing a consensus to find acceptable solutions during this meeting, but we feel that the position of our country should be well known by all the member states before launching the action plan. Thank you very much.
Merci beaucoup.
Thank you very much, Hungary. I give the floor to Norway and the UK after that.
Chairman, we thank the Secretariat for the important initiative and the thorough technical work done in connection with the action plan. We appreciate the thorough consultations held with Member States on this issue. While previous actions has proven successful to reduce maternal and perinatal deaths, a joint effort to further reduce unnecessary deaths and improve access to guidance, education, and health services is still needed. The rise in HIV and other STIs in the European region is alarming and underlines the need for this action plan to ensure accessibility to health care for all, regardless of sexual orientation, marital status, gender, and socio-economic differences. Norway is currently revising our national strategy on sexual health. This action plan will be a useful and valuable resource to complete this work. We recognize that sexual and reproductive health is an integral part of the general right to health. This right must be protected and respected. Norway, furthermore, has a policy to promote acceptance of sexual rights in all relevant UN negotiations. We recognize that it has been difficult to come to a consensus on this in the action plan. We regret that it does not seem possible to stick to the language approved in the 2001 Regional Strategy on Sexual and Reproductive Health, which has 2 references to sexual rights. Norway would in this regard also echo the sentiments expressed by Sweden on the importance of human rights and of promoting sexual and reproductive health and rights in our region and beyond. Finally, Chair, we support the action plan and hope this regional committee will adopt it. Thank you.
Merci la Norvège. Je passe maintenant la parole.
Thank you, Norway. I give the floor to the United Kingdom, followed by Slovakia.
Thank you very much, Mr. Chair. I will be very brief. The UK congratulates the Secretariat for meticulous handling of a long and difficult consultation and wishes to align fully with the statements made by Sweden and Estonia. Thank you very much.
Merci, le Royaume-Uni. Donc
Thank
la
you,
Slovaquie
the
sera
UK.
suivie par le Luxembourg.
Slovakia followed by Luxembourg.
Slovakia will not have a national speech. However, we would like to inform that according to the rules of procedure, we submitted to the Secretariat the national reservations in written form regarding conscientious objection, sexuality education involving education for matrimony and parenthood, role of consent of parents, disbursement of contraception and surrogate motherhood, including birth rate data missing, sustainable population policies, fertility awareness missing. Thank you.
Merci, la Slovaquie.
Thank you, Slovakia. Luxembourg, followed by the Russian Federation.
Thank you, Chair. I will be very brief. We welcome the action plan and Luxembourg is ready to adopt it. Sexual and reproductive health and rights is a key priority for our government. We commend WHO for the efforts in elaborating this action plan in close collaboration with Member States, even if we would have liked stronger language in the text. Thank you.
Netherlands does not raise. No. Okay. Merci pour.
Thank you very much for your statement. Spain has not spoken. Russian Federation first. Russian Federation. Chair, the Russian Federation would like to thank the Secretariat for the work done on the action plan for sexual and reproductive health and for the assistance given in implementing the agenda in the field of sustainable development up to 2030. In Russia, reproduction is seen as a health priority. At the present time, the Ministry of Health of Russia is developing a concept of reproductive health and demographic policy in Russia. We feel it is vitally important not only to counter loss of reproductivity and reproductive health, but also reproductively healthy lifestyle, which will ensure an increase of reproductive potential with stress laid on prophylaxis and preventive measures, and to promote a holistic approach of the population to its health. This is a very important point when it comes to state safety. Now, here it should be pointed out that the draft plan of action contains a number of provisions that have not met with universal consensus, and this has been pointed out by a number of member states. Therefore, the Russian Federation carrying out the action plan will be guided by the provisions of paragraph 19 in that national legislation is given priority and cannot agree to any changes there. Thank you.
Merci, la Fédération de Russie. Donc l'Espagne qui sera.
Thank you very much. Spain and then Republic of Moldova.
Thank you, Chair, Madam Regional Director. Spain supports the contents of this action plan. They are in line with our country's legislative policies, which also encompasses accountability and a comprehensive approach to sexual and reproductive health and rights, including maternal health as a human rights-based approach demands. Our policies aimed at promoting sexual and reproductive health and rights are expressed as laws and regulations that guarantee them and as health strategies that make them possible, as well as healthcare models to implement these strategies. Women's right to universal access to sexual and reproductive health is included in the current portfolio of services of Spain's national health system, both referring to care during pregnancy, childbirth, and postpartum, as with regard to family planning during fertile years. Our national health system also guarantees access to safe and effective methods to avoid unintended pregnancies that are appropriate for young people and adults. The responsible exercise of sexual and reproductive rights is the foundation of our national and regional programs. As a part of this commitment, we urge special attention to promoting relations of mutual respect and equality between men and women, and to the needs of adolescents with regard to the education and services necessary for them to experience their sexuality positively and responsibly. Thank you very much.
Merci l'Espagne et enfin donc la
Thank you. Spain, and finally the Republic of Moldova.
Dear Regional Director, Excellencies, distinguished delegates, ladies and gentlemen. The Government of Republic of Moldova fully supports the Action Plan for Sexual and Reproductive Health towards achieving by 2030 Agenda for Sustainable Development in Europe, leaving no one behind, which is intended to accelerate progress towards improving sexual and reproductive health and well-being for all people, and expresses the high appreciation for the WHO Regional Office for Europe and all engaged international partners such as UNFPA and countries who contributed to this to development of this document. The Government of Moldova has initiated development of the National Programme on Sexual and Reproductive Health and Rights that represents a strong commitment of the state to the European Health Policy Health 2020 and International Conference on Population and Development Beyond 2014 and its prioritization with the Sustainable Development Goals nationalization process. The national programme is a rights-based strategic document that is being developed in highly coordinated and participatory approach and fully in line with the European Health Policy, Health 2020, the European Action Plan and national priorities in sexual and reproductive health. On behalf of the Government of Republic of Moldova, I would like to thank and acknowledge the extensive support provided by WHO Regional Office for Europe and UNFPA in this process. Thank you.
Merci. Nous avons encore l'intervention.
Thank you. Kyrgyzstan, please, you have the floor. Chair, Madam Regional Director, ladies and gentlemen, Kyrgyzstan fully supports the Action Plan for Sexual and Reproductive Health towards achieving the 2030 Agenda for Sustainable Development. In Kyrgyzstan, we have adopted recent legislation about reproductive rights for citizens and guarantees of the enjoyment of those rights. We also have a national strategy for reproductive health. And within Kyrgyzstan, it's recognized as one of the 7 priorities that we have for healthcare in our country. And here we talk about reproductive choice. We also seek to improve access to information for people in our countries, to have family planning services available, and to have services available that can assist with fertility issues. This is particularly important for all of the people in Kyrgyzstan, and these services are now available. In addition to that, we are seeking to make women more aware of issues relating to safe maternity, family planning, and to health when planning for their families, and indeed at the time of birth and postpartum. We also focus on making information available on contraceptive methods, and we give them relevant advice. All of this then is part of our strategy intended to promote safe motherhood. And one of the key features of that is ensuring that everyone has access to this information, and we have a relevant decree that has been adopted for our population. Thank you. Thank you, Kyrgyzstan. Well, I think that brings us to the end of statements from member states. Before giving the floor to non-governmental organizations, I would like to invite Mrs. Alana Armitage from the UNFPA, the Fund for Population Activities, to take the floor. You have the floor, madam.
Merci, Monsieur le Président, honorable ministers, Excellencies, Deputy Executive Director, Regional Director, ladies and gentlemen. UNFPA very much welcomes the proposed action plan for sexual and reproductive health and appreciates the opportunity to contribute to this discussion. The action plan presented today for endorsement will ensure that all individuals can exercise their basic human rights, including those related to the most intimate and fundamental aspects of life. I would like to express our appreciation to WHO Euro member states for their commitment to advancing this agenda and to recognize the WHO Regional Director and her team for their leadership and the participatory process in which led to the development of the action plan. This comprehensive framework, adopted at national level, would contribute greatly to UNFPA's work in support of member states in the region. UNFPA is pleased that the action plan responds to the findings of the 20-year intergovernmental review of the implementation of the Cairo International Program of Action, which took place in 2014. That review highlighted that our region still faces significant inequalities with respect to maternal and infant under 5 mortality, unmet need for contraceptives, high numbers of unsafe abortion and adolescent pregnancies, rising STIs and HIV, and cervical cancer. The action plan will also help us to grapple with the region's unique population dynamics that are of concern to several member states by keeping people and their rights at the center. We were also delighted to support WHO and member states of the Eastern Europe and Central Asia region with the consultation on the final draft held in Tbilisi in March this year, as mentioned by the Honorable Deputy Minister of Health of Georgia. We found that consultation generated valuable inputs and strong support from the governments involved and ensured that their priorities were reflected. Mr. President, distinguished delegates, the adoption of the 2030 Agenda for Sustainable Development reaffirms the vision of the Cairo Program of Action. The development includes the ability to make informed choices and decisions without any fear, discrimination, threat, or violence. Realizing the sexual and reproductive health and rights objectives in the action plan will increase our prospects for achieving all SDG goals in the region, and especially those related to health, education, gender equality, and peace and justice. The WHO European region is seen as a leader on advancing sexual and reproductive health and rights. Adoption of the action plan will be a significant step forward for the region and an inspiration to the rest of the world. UNFPA looks forward to continuing our close collaboration with member states, WHO, and all partners to advance the health and well-being of all people in the region. I thank you for your attention.
Merci beaucoup, Madame Armitage.
Thank you very much, Mrs. Armitage. I now give the floor to 2 non-governmental organizations that have requested the floor. Firstly, the International Federation of Medical Students Associations, and indeed there is a written submission from them on the WHO website. Then we have the International Planned Parenthood Federation.
Thank you. Honorable Chair, distinguished delegates. The International Federation of Medical Students Associations welcomes the European Action Plan for Sexual and Reproductive Health. As an organization with a strong focus on sexual and reproductive health and rights, we encourage the implementation of Sustainable Development Agenda Target 3.7, universal access to sexual and reproductive healthcare services by 2030. This, since the right to sexual and reproductive health is an essential component of the right to complete health and well-being. While committing to this plan of action, it is of paramount importance to ensure that all member states adhere to the agreements, have the adequate resources and will to achieve the Sustainable Development Goals by implementing a proper monitoring, evaluation and follow-up system. Secondly, it is essential to ensure empowerment of the health workforce executing this action plan. As medical students of today and future healthcare professionals, we can still experience a lack of support and education in such topics in all parts of the world, including the European region. These need to be tackled in order to achieve a meaningful implementation. Lastly, we believe that it is every woman's human right to have full autonomy over decisions related to when and how many children to have. There are, however, still European countries with strict abortion laws and policies, as well as stigma on abortion-related issues. Access to legal and safe abortion is essential to lower maternal mortality. Therefore, IFMSA encourages all governments to provide safe, legal and accessible abortion in order to minimize unintended pregnancies and unsafe procedures with its accompanying detrimental physiological, financial and mental consequences. Thank you.
Honourable Chair, delegates, ladies and gentlemen. In my position as Regional Director of the European Network of the International Planned Parenthood Federation, IPPF, I am speaking on behalf of members, staff and volunteers across 36 countries, ranging from my own native Ireland to Central Asia, from Scandinavia to the Balkans and the Mediterranean. IPPF strongly welcomes and supports the WHO's action plan on all levels, but particularly the understanding that ensuring the sexual and reproductive health of young people is fundamental to triggering lifelong well-being and happiness. The message of the vibrant movement of young people at the heart of IPPF is clear. If we want sustainable development, it is time for Europe and Central Asia to agree the main actions necessary to promote sexual and reproductive health and rights. Because across our region, life is becoming ever more challenging. We are all seeing the repercussions of economic and political instability on the physical and mental health of our citizens and the resulting pressure on our health services. So the question that we face in this changing world of ours is, how do we support young people to gain the confidence and life skills to enter into loving relationships and lead healthy and productive lives, to become strong and secure adults who are mentally, emotionally and physically capable of withstanding stress and uncertainty, and who can continue to hold together the fabric of our societies even in difficult times. IPPF's 60 years of experience has shown us how the fulfillment of sexual and reproductive rights makes a fundamental and essential contribution to lifelong health and well-being, helping to create healthy families and resilient societies. We have learned when we take an approach that empowers people, especially young people, with knowledge and information on this part of life, which is so critical to all of us, they use it to make healthy and responsible choices. Thus, IPPF and our members and volunteers applaud this action plan, which reaffirms the absolute necessity of a coherent, holistic, whole-of-life approach to sexual and reproductive health based on gender equity and human rights. We urge the member states to adopt this resolution and embrace an action plan which goes to the heart of who we are in Europe, nations who trust and empower our citizens so they live and love healthily and happily throughout their lives. Thank you.
Merci beaucoup. Donc,
thank you very much. So, it's almost 7:15. We've had a long day. I would like to thank you for your many contributions to our discussion. I think your participation has shown just how much the Regional Committee is interested in this issue. And indeed, we've had a very lively and stimulating discussion here. I suggest that we now adjourn and take up our work again this morning. Well, in fact, we're going to see each other before then, because I know the regional director is expecting to see us this evening at 7:30 at the reception she's hosting at the Opera House. Many questions have been asked, and there are many answers that will have to be given. And I'm sure that our experts will need a little time to respond to all of the questions put to them here this afternoon. My proposal then is this. Tomorrow, Wednesday, the 14th of September, in the afternoon, following nominations and designations, I suggest that we take up once again this item on which there have been so many contributions.
De nos discussions, nous avions terminé par
Going back to where we were,
la déclaration des organisations non gouvernementales après
we had heard
avoir
from member
entendu le
states,
Fonds
and
des
then we
Nations Unies
heard
pour la population.
from the
Et donc, c'est les docteurs
UNFPA
Galia
and
et
then
Lasdan
from
qui
NGOs.
vont adresser les
And we are
commentaires
now going to
que
hear
vous
a
aviez faits
response
hier.
to those comments. Dr. Galia and Dr. Lasdan will be responding to comments made yesterday.
Thank you, Mr. President. Yesterday, we had a thorough discussion of the Sexual and Reproductive Health Action Plan. We, as for the last 2 years, the discussion was really deep and characterized by a very high level of professionalism and mutual respect in an area that is very sensitive. We really appreciate the very strong supportive comments as well as the respectful presentation of dissenting comments. We have heard your suggestions and your comments and have circulated hopefully in a reflection of what you have instructed us, a reflection of a shorter resolution that is probably closer to adoption status in this current form. We have also confirmed with Hungary, Malta, and Sweden their comments on each other's comments and have circulated a very short number of amendments to the action plan where taking on board the important contributions of those 3 countries. So we would present those to you as part of the adoption this afternoon, the proposal for adoption this afternoon. There were some process, technical and definitional issues, and I will deal with one of them. Gunta will deal with the technical, and Ian Askew, the Director of Reproductive Health and Research in headquarters, will deal with the third. In terms of the process, there has been a number of comments made with regard to countries such as Russia, and we understand Turkey, that give great importance, as do other countries, but these 2 countries express their position very strongly. They give great importance to the autonomy of the country to define its own laws. We were told by Turkey that we should not be stating so strongly the instructions to countries. We would put forward, and we understand that this is also acceptable, the fact that very early on in the discussions we have agreed to include the sovereignty clause, paragraph 19 of the document, that has clearly subordinates any evidence-based direction that we have in the action plan to the national situation and legislation. This is clearly stated in the scope document, in the scope paragraph 19. We have also accommodated a number of other points in the process of the development of the document, such as Malta's suggestion, not at this stage, but a much earlier stage, to ensure that all mention of sexual and reproductive health and rights is footnoted by a number of global mandates that have been approved universally. So we hope that by taking on board the autonomy, the shortening of the resolution, and these minimal changes proposed by Hungary, Malta, and Sweden, we can meet all the requirements to allow a consensus to proceed, which then can allow the resolution and action plan to be adopted. That's all I have to say. I will hand over to Gunta, who will discuss with a deep thanks again for the engagement and the real importance that you have assigned to this document.
Thank you very much. Director General, Regional Director, the President. As I always know the authority link very well, I will start with my colleague, Ian Askew, who is Director for Reproductive Health and Research, to help me first. That will ease my answer. And Askew will give a little bit more details on the questions that were raised by several of the countries, why sexual reproductive health and rights, and where sexual health is defined. Ian, may I ask you, please?
Thank you very much, Director General, Regional Director, President, and distinguished guests and delegates. I was asked to clarify terminology used around the concept of sexual and reproductive health and rights. This concept is evolving and has gone through various developments over the last several years. Indeed, in 1974, a technical working group in the WHO European region first convened and provided a definition of sexual health, and thereafter the concept and definition was reaffirmed in the ICPD Programme of Action and again in the 1995 Beijing Declaration and Platform of Action, both of which recognised human rights as a key principle for achievement of sexual and reproductive health. In 2002, a WHO technical working group revised the definition of sexual health to become, and I quote, a state of physical, emotional, mental and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected and fulfilled. The report and this definition are available on the WHO website. Sexual rights were defined by this working group to include internationally recognised human rights that are fundamental to the realisation of sexual and reproductive health. These rights include, for example, the right to the highest attainable standard of health, the right to marry and to found a family and enter into marriage, the right to decide the number and spacing of children, and the rights to information as well as education, as well as several other basic human rights. This concept of sexual health was reaffirmed as one of the 5 pillars in the 2004 Reproductive Health Strategy, which was adopted by the World Health Assembly, and which also recognises human rights as a key guiding principle to the achievement of sexual and reproductive health. Thank you.
Thank you very much, Dr. Askew. And I want to, of course, thank all countries that made their statements yesterday and confirmed that sexual and reproductive health really matters for all. It was good to hear the progress in many areas of the broad spectrum of sexual and reproductive health, from decreasing unmet need for family planning in Georgia to progress with youth-friendly health services in Tajikistan, decreasing maternal and perinatal mortality and morbidity in Russian Federation and Turkmenistan, and much more. At the same time, you alerted this regional committee meeting on the remaining challenges, such as inequities and inequalities in the area of sexual reproductive health, and lack to access on information and quality services for many women and men, especially adolescents, people living in the rural areas, as well as migrants. Fully agree with Turkey, Switzerland, former Yugoslav Republic of Macedonia and other countries emphasizing the importance of multi-sectorial, the whole of government approach to ensure further improvement of sexual and reproductive health. The discussion was very rich, and I'm sure it is just the beginning of fruitful collaboration. However, I would like to answer some of more specific questions. Turkey. Why we need a separate regional sexual reproductive health action plan if so many global and regional political documents exist? The present regional action plan is adopting the global and regional approved documents. 2030 Agenda for Sustainable Development is mentioned in the title, but many more are in the Annex 1. Together with countries, during the extensive consultation process, the action plan presents adaptation of these documents to the regional circumstances, to the regional issues, maybe topical not for many other countries and other regions, such as, of course, inequities, but also infertility, high caesarean section rate, links with smoking and sexual reproductive health, algal and sexual reproductive health. That is very specific to this region, or at least very topical for this region. Slovakia, fertility awareness methods. 31b includes the wording, the widest possible range of evidence-based and effective methods that are acceptable and affordable to all clients. And of course, for sure, it includes the fertility awareness methods. Some countries mentioned the important role of parents in sexual reproductive health. I cannot agree more, because examples from countries that really show the very good progress in this area have also showed the involvement of parents is really crucial to achieve that. And that's why parents are mentioned in 27D and 38D. So, with this just small, short summary, I really would like also to thank all for the kind words that were addressed towards the WHO Secretariat and this team, because it's not only few of us, it's all of us who was working around that. And this is the first action plan that was so really joining all forces, because starting from HPV vaccination, colleagues working in STI and HIV program, and many, many more, not speaking, of course, not missing non-communicable diseases. I really would like to thank you all, and would like to thank Regional Director for her support. Thank you.
Thank you very much to you, Dr. Lesdan. Merci aussi au Dr. Galea, au Dr.
Thank you very much indeed, Dr. Galea, Dr. Lesdan, and Dr. Askew. I thank you all for your work, and I also commend the work that has been done on this by the SCRC. So are we now ready to adopt the draft resolution as distributed this morning? This is the draft resolution that reflects amendments made to the action plan on the 13th of September.
Je vous demande, pour ceux qui veulent prendre la parole, de soulever leur pancarte.
If you wish to take the floor, please indicate that now. Malta, please.
Thank you, Mr. Chair. Just one little amendment to the resolution in footnote 1. Document EUR R66/13 as amended, because we need to reflect the amendments proposed. That's my request. Thank you.
Now I turn the floor. Je passe la parole aux Pays-Bas.
Netherlands, please. You have the floor.
Thank you, Chair. Having heard the different views and in the spirit of consensus, we can reluctantly accept the action plan with the amendments suggested by Malta and supported by Sweden. That does, however, not change our firm belief that this action plan can only be implemented effectively when all human rights are respected, protected and fulfilled. We strongly regret that the reference to the importance of aligning with international and regional human rights treaties and other relevant international agreements was removed. The Netherlands remains very committed to sexual and reproductive health and rights of all. Thank you.
Merci les Pays-Bas.
Thank you, Netherlands.
Je ne vois pas d'autres objections.
I do not see
Donc je
any
considère,
further objections.
au nom du comité régional, le 66e du nom,
that the 66th
dans le
Regional
cadre
Committee,
de l'esprit de consensus,
in a spirit of
que cette
consensus,
résolution est adoptée.
has adopted the resolution in question.
Et je pense que... Oh. Donc la Turquie et la Hongrie ont levé leur
Turkey
pancarte.
and Hungary are now asking for the floor. Turkey, please.
Alors la Turquie.
Thank you, Mr. Chair. Since it seems only a few countries left still have concerns on this document and resolution, and others already adopted, Turkey do not want to block the way, respect to all the works and processes have been done so far. But there are still problematic areas left in the document, especially Para 21, subparas A and C, dictating methodology to the countries. WHO documents should guide us, not to order. Turkey wants to be disassociated from that document and resolution. We also want our position clearly explained in the report. Thank you, Mr. Chair.
Merci la Turquie. Je passe la parole à la Hongrie.
Thank you, Turkey. Hungary.
Thank you, Mr. President. Mr. President, Madam Director General, Madam Regional Director, Honourable Ministers, dear colleagues. Ladies and gentlemen, Hungary, in the spirit of the consensus, hasn't objected to the formal adoption of the action plan. At the same time, Hungary wants to emphasize that it interprets the whole action plan and the resolution in accordance and in the sense of the ICPD Programme of Action and Beijing Platform for Action, as well as the 2030 Agenda, serving also as basic references in the fields of sexual and reproductive health and reproductive rights. The adoption of the Programme of Action of the International Conference on Population and Development, ICPD, and the Beijing Platform for Action marked a remarkable consensus. They placed the enjoyment of the rights of women at the heart of development and brought important gains in the fields of health. Hungary remains dedicated to its commitments in the field of rights of women and women's health. We are deeply committed to the implementation of the ICPD Programme of Action and Beijing Platform for Action, as well as the 2030 Agenda, serving also as basic references in the fields of sexual and reproductive health and reproductive rights. The UN document doesn't use the phrase of sexual and reproductive health and rights. Rather, it consistently applies the phrases of sexual and reproductive health and reproductive rights. We consider that the SDGs clearly define the scope of international processes. The term of sexual and reproductive health and rights and related issues like sexual rights, comprehensive sexuality education are lacking consensual definition at international level, including within the European Union. These issues are interpreted and promoted by Hungary in the context of the 2030 Agenda for Sustainable Development, the ICPD Programme of Action and the Beijing Declaration and Platform for Action in line with relevant national legislations. For this reason, I regret to inform you that Hungary is not ready to consider those points dealing with the SIHR in the Action Plan as unanimously agreed and satisfactory, and we wish to disassociate from that SIHR approach and SIHR language used in that. We ask, therefore, the Secretariat to reflect our declaration in the report of the committee meeting. Thank you very much.
Merci la Hongrie. Je passe la parole à la Pologne.
Thank you, Hungary. Poland, please.
Thank you very much, Mr. President. Mr. President, Madam Director General, Madam Regional Director, Honourable Ministers, as an explanation of position, bearing in mind Polish statement made yesterday, I would like to announce that, regretfully, for the reasons described in that statement, Poland wishes to disassociate from the consensus that has just been made among other member states on the text of the action plan and adoption of the resolution EUR/RC66/ConvDoc/9/Ref1. Request the Secretariat to duly reflect this position in the text of the official report from this session. Thank you very much.
Merci donc à la Turquie, la Hongrie et la
I
Pologne
thank
pour
Turkey,
avoir
Hungary and Poland
respecté l'esprit de consensus
for having respected the spirit of
ayant
consensus
indiqué leur position
while
nationale.
indicating their
Cet
national
esprit de
positions.
consensus qui caractérise les
The
travaux
spirit of
multilatéraux
consensus is
de cette
characteristic of
organisation
multilateral
dans
work
le cadre
within
des
this
Nations Unies. Je pense que
organization
cet esprit de
and
consensus,
under
nous
the
pourrions
auspices
l'offrir à
of
notre
the
directrice
UN.
générale
And I think we can
en
certainly
témoignage de nos
offer
travaux,
that
puisque je
spirit
crois
of
qu'elle va
consensus as a
devoir
sort of
bientôt
gift
nous
to our
quitter,
Director General, and I think that that
que ce
spirit
sera
bears
sans
witness
doute
to the way in which she works.
son
I know she
dernier
has to
comité
leave
régional
us
à
very
l'OMS
shortly.
Europe.
And
Donc,
this
pour lui
will
offrir
be
ce
her
cadeau et pour
last
son départ, je
regional
propose
committee
que
as
nous nous
Director
levions
General.
tous
So
et que
let
nous
us
lui
offer that
fassions une
spirit
ovation.
of consensus as she leaves, and let us stand and give her an ovation on her departure at this moment.
together with AB, the Deputy Director. Merci beaucoup.
Thank you very much.
Donc, nous allons passer à l'autre point du jour qui avait été ajourné donc,
So,
au
we shall
cours de
now
nos
move
travaux
on
et donc qui
to
concerne
another agenda
un
item that had
sujet
remained in
lié
abeyance.
finalement d'une
And this
certaine façon,
actually deals with a related
très important
topic
également qui
in
est
some
la
ways,
stratégie pour
and
la
a very
santé
important
et le
topic.
bien-être de la femme
That is to say, the strategy
dans la
on women's
région
health and
européenne de
well-being
l'OMS
in the WHO
avec
European
des
region.
documents qui sont attachés
And we have
sont
a
donc
number of
le
documents to deal with on this issue. Document 14, RC66
le
14,
ConfDoc 10
ConfDoc
et le
10,
RC
ConferenceDoc
66
10,
14
and
addition 1
also
pour les
document
incidences financières.
14 add 1 on financial implications.
Donc, je propose au docteur Galéa et au docteur Jordi
So I now turn
de
to
répondre
Dr.
aux
Gallia and
commentaires et aux
Dr.
questions
Jordi,
formulées.
and I invite you now to respond to questions and comments made earlier in our discussion on this item.
Apologies, Mr. President, we were catching up. The comments on the, and my lease on this chair will expire quite soon, I hope, having spent quite some time here on this during this meeting. The comments on the women's health strategy were overwhelmingly positive. Both divisions are grateful for the very strong support, the many ways in which you have identified that you can or are already using this document to develop national strategies and plans. We did have a comment about the data disaggregation, that it would be useful to reflect that there is a long list of dimensions Poland has identified in the document that are mentioned by us as being the way we should disaggregate data under the spirit of leaving no one behind. We know very well that there are issues in relation to data being disaggregated, and we do know that in reality many countries have difficulty when it is disaggregated to even interpret and use that data. So we take that comment very seriously. At the same time, we are happy to note that part of the background documentation of the Sustainable Development Goals under the discussion on human rights, leaving no one behind, and under the data disaggregation discussion, there was a string of dimensions for data disaggregation that we have copied faithfully into this document, so that in drafting the women's health strategy, we did not identify new sources or new modes of data disaggregation. Indeed, unless we find ways to count people who might be marginalized because of sexual orientation or gender identity, then it is likely that they will be left behind by the appropriate policies. The action plan, the strategy, also would reflect that if this data is collected, human rights would only be respected if that data is collected with appropriate provisions for protection of the data and for privacy. We think that Poland has raised a very serious point here, but that it is well reflected in the discussions that have preceded. I do not know if Isabel or Piroshka want to add something to this on further comments that were made by the other member states.
No, thanking for the comments that were put on the table, particularly acknowledging gender equality, gender as a social determinant, and speaking up about women's health and women's rights as human rights. I think that we take those very seriously, and I think that also the interventions by the panelists were just an aperitif of what member states have to say later on. So thank you for that, and supporting the comment that Gauden has done, also the one on the ILO and the contributions. Actually, the examples taken there are taken by discussions which are ongoing with ILO, and see how the pension system recognizes also the unpaid work. Thank you very much.
Thank you, Mr. Chair. The floor is back to you.
Merci beaucoup, Gauden.
Thank you very much, Gauden.
Je pense que nous pouvons donc considérer la possibilité d'adoption du projet de résolution RC66 Conf Doc 10.
RC66 Conf Doc 10.
Ce projet
Are there
de
any
résolution.
objections to this draft resolution?
Je n'en vois aucune.
I can't see any.
Ce projet de résolution
No
est donc adopté.
objections. This draft resolution, therefore, is adopted.